So now I'm going to talk about the stages of labour. So early labour is the things where you potentially will be at home, so where the contractions are stopping and starting and coming regularly but building up. The first stage of labour is what we consider 4 centimetres onwards, and that is up till 10 centimetres. This is when we consider you an active labour. The contractions are coming nice and regularly and strongly, not going away, lasting for a minute, and ideally uniform, so the same strength, same frequency. Second stage of labour is from when you're pushing onwards, and then the last stage of labour is the third stage of labour, and that's after you've had the baby and then we need to deliver the placenta. There is 2 ways of doing that. We can give you an injection, which is what we call an active third stage, and that helps your womb to contract down and helps to deliver the placenta. And then the other option is what we call physiological third stage, and that's what women have been doing for millions of years, and that's where your body naturally produces the placenta. If you were to start bleeding, we automatically turn it into an active third stage, where we give the injection to help your womb contract down. However, if you're all low risk and you're fit and well, we can wait and we can do what we call delayed cord clamping, which you may have read about, but that's where we let blood flow from the placenta be passed through to the cord and go to baby. Cutting the cords is also very important to families, I know, so we can, if you let the midwife know your plans, and then the midwife can support your partner doing that. Sometimes in emergency it has to be done quite quickly, but we will talk to you about that at the time if it needs to be done. Another thing to mention, so skin to skin. Skin to skin is really important, so once baby's born we would recommend doing that, and it's basically putting baby on your skin. It's really good for bonding, it's really good to help establish feeding. It's also just very nice and keeps babies nice and warm and helps them to adapt to life outside and being born. We also talk about a thing called vitamin K, and it's to do with blood clotting disorders with baby. Your individual midwife can talk to you about this, but have a little think about it, whether you want baby to have that. It's an option, and your midwife in the clinic will have a leaflet about that if you want some more information. Furthermore to this, if you have any questions or anything else that you want to talk about, next time at your antenatal appointment, speak to your midwife and she'll be more than happy to answer any of your questions. So this is one of our pool rooms, as you can see. So this is our pool, standard room here on the birth centre. We aren't doing tours at the moment, as you can understand from COVID-19, but if you go online there is the virtual tour, so you can see the difference between a labour ward room and a birth centre room. I hope that's been okay, and I look forward to seeing you here in labour. Thank you.